think it's good to think of this as a technology that's going to help rejuvenate your face, but it's not going to be what surgery would be. What is Ulthera? Well, it's basically a focused ultrasound. This company was able to work out the science behind it and do this so that strategically we can focus energy at two levels. One is at the skin level, and then one is at the muscle level. And those are the two tissues we want to tighten. So if we focus that energy here, a little dot causes a little coagulation or heat thermal injury, it causes it to shrink and contract. And at the same time, it signals the body that this is an injury, and it puts down collagen to repair it. So you're also stimulating new collagen in that area to be created and formed.
I'm just going to do a sequence. So she just does little tiny movements. If you watch Dana's hands, she's just going about 2-3 millimeters between each activation. So we're creating this really dense matrix down deep on the face of these little tiny injuries. In a full face treatment, by the end of it, you have 8,000 of these little tiny injuries down deep working to produce new collagen.
There's no downtime. There's no recovery. Now, there may be a little side effect here I'll mention in a second, but you know, it's really simple afterwards. You just let your body do its thing, which is to build the collagen and to tighten.
Dr. Hall, on a scale from 1 to 10, 10 being the worst pain you've ever felt in your life, what would you kind of rate this at? 5. This is about a 5.
The ultrasound is like little dots, so it's very quick. It's not like, okay, I'm going to stick you with this needle and it's going to hurt and it's going to burn while I do it. It's very quick and rapid.
And a good way to describe it is kind of like a hot finger in a series. But the nice part is when it's over, it's over. So it might, kind of, it might be a little spicy in certain areas, but when it's done being delivered, that pain should really linger there.
We've taken and done this, and we usually do this with our patients, is we'll do the treatment, we'll do half the face, and then let them look in the mirror. You can sort of see the difference immediately that they get. And again, that's going to get better. You may notice some swelling afterwards, or you probably will notice some swelling afterwards, maybe not that day, for the next couple of days, a little bit of swelling. Again, we're creating a thermal injury, and your body's going to react to that with some swelling. But again, it's not anything that's going to make you unpresentable by any means. Now, sometimes there are side effects that are transient, which means, like, there's some nerves that are in the area that we're treating that may get injured or traumatized from the thermal injury, but it's a transient thing that goes away and heals in a matter of 2 weeks to as long as 3 months. So the company has told us that they've done over 30,000 of these treatments across the world, and they've not had any long-term complications or side effects. So to me, that's a good number. So in summary, it's non-surgical, non-invasive, no downtime, it's proven, and it's safe.
I'm looking at it straight on.
Nice.
His jowls look good too.
Even right here.
Kind of, there's that little laxity down there.
Oh, you are so handsome.
Oh.
I thought